Hi, I'm Dr. Nichelle Haynes.
And I'm Dr. Kristen Lassiter.
And we're Medical Mamas. This is your place to get evidence-based information about your reproductive mental health.
Meaning mental health in relation to reproductive hormone changes, like around your period, pregnancy, postpartum, menopause, infertility, all that fun stuff.
Today we're going to talk about what to expect in your first psychiatric appointment.
So psychiatric appointments can be really scary if you've never seen a psychiatrist before, and that's totally normal to be nervous and anxious about it.
Right, of course. I mean, there's a lot in the media about psychiatrists being villainized, or, people can be scared of having to discuss things with other people, and we just want you to know that we're regular people too, and give you some information about what to expect so you feel less nervous about it.
So oftentimes when you go to a psychiatrist's office, it will look just like a regular kind of office space. So there usually is a couch and a chair and a table, and kind of looks like a living room or like something like this. Sometimes they'll have a front desk person. Sometimes it will just be a psychiatrist by themselves.
Of course, there are times where you're in like maybe a more academic setting where it might look a little bit more like a more clinical setting. But often it looks like this. This is our office, so you can kind of see what it's like. Who will be there? Your psychiatrist?
Usually just the psychiatrist. If you're at a teaching hospital, sometimes a resident or medical student might be sitting in on the interview, but it's always your right to ask that they leave if you don't feel comfortable with that.
Of course. Generally, a psychiatric appointment is longer than a regular medical appointment. Like if you're going for, I don't know, an ingrown toenail or something, they'll just look at it and tell you the treatment plan. But a lot of psychiatrists will spend more time with their patients because it's a lot more nuanced to have all of the information. So your appointment might be an hour or more even for your first appointment.
Yeah, unfortunately we don't have like blood tests or imaging and things like that we can do to help us make a diagnosis and form a treatment plan. So it takes a lot of gathering information to understand exactly what's going on and how it can best help you.
So one important thing to know is that psychiatrists are physicians. We did go to medical school, so we're going to go through a lot of medical history and medical information and ask those questions of you.
Yeah, we want to know what past medical issues you've had before, what medications you might be taking right now, what you're allergic to, because all of those things can influence not only the treatment that you get, but they can also be influencing the symptoms that you're currently experiencing.
Maybe one example is, and the reason we would get vitals is that having high blood pressure can definitely influence whether you're feeling anxious or not. So we'll get your vitals, and maybe that's a simple fix, that there's something else there, or we would want to have that information to help guide your treatment.
Yeah, so other things that we might get are labs, because we want to look through other comorbidities or things that might be going on in your body that could be influencing your symptoms or could be even the cause of your symptoms. So anemia oftentimes can make people's depression worse or look like depression. Thyroid disorders can look like anxiety, mania even, or depression. So things like that we want to check. Vitamin levels, how your liver's doing, kidneys, all those good things. And there's a reason behind all of it.
We also might want to know about family history, to know, I have a family member who had this thing, or having that information might inform what you're more at risk for. So that would be important information for you to have before coming to an appointment if it's possible.
Yes, and also family history in terms of their psychiatric illnesses. That will help us understand better kind of your genetic predisposition to these illnesses as well.
So I think that's most of the medical stuff that you might talk about. If you're seeing a perinatal or a reproductive psychiatrist, we would probably want more information about your reproductive history, meaning any pregnancies or infertility, and how each of those situations went for you, to have more information there, because maybe if you've had postpartum depression in the past, you're of course at higher risk. So that's just one example of why we would want to have that information.
And if you're coming in for mental health disorders around your period or perimenopause, then we'll also want to know things like, when did you first start your period? What were things like when that first happened, and how has that progressed over time?
We'll ask a lot about your current life, like what's your living situation like? Who is a support for you? Are you in a romantic relationship? What about employment? What about schooling? What were things like when you were a kid? There's a lot of information that we would want there.
Yeah, definitely talking about childhood, as cliche as it may sound, it's really helpful for us to kind of get a better idea of your life and development. And as we'll talk about in other videos, child development is really important for later on in life and mental health. And so it's important for us to ask those questions, even though it might seem silly.
Mm-hmm. What is your diet like? How do you get your exercise in? Do you get any movement in? What is your day-to-day like? What are your stressors? Those are other things that might come up at your appointment.
So the next thing that we'll often talk about is why you're here, what symptoms are going on, what things are bothering you. We'll ask a lot about sleep and details about your sleep. We'll ask about your mood, how your anxiety's doing physically. Are you noticing, muscle tension? Can you relax? Just lots of things, gathering information about what's going on with you in the present moment, like in the last 2 weeks, and even looking back at what symptoms have you had in the past.
Mm-hmm. Right. I think past symptoms are really important because they can really inform what we're treating, right? If you're right now feeling down or depressed, and you've had a period of time in your life where you've been manic or hypomanic, meaning you didn't need very much sleep, you were restless, had a ton of energy, you were maybe impulsive or felt irritable or super happy, that's a really different picture, and that's going to inform the assessment and plan. So we wouldn't want to treat someone who has bipolar disorder the same way as we would want to treat someone who has depression, because the treatments with regard to medications are different. So we want to have all of that information so that we're not worsening things for you, the best that we can, of course.
And a lot of times people can feel really shameful about the symptoms that are going on in the present moment or symptoms that they've had in the past. But this is our everyday life. We talk with people about these things all the time. There's absolutely no shame in it. It is a medical mental illness. It's not something that we judge you about, or that we think that you're weak or crazy, or I don't know, I get all sorts of things that people think that I'm thinking about them, and we're not, I promise.
Absolutely not.
It's helpful to know what you've been through and what things have looked like for you, so that we can form a really accurate picture of the diagnosis and what's going on. If you're not upfront and honest about things that have been going on, then it makes it a lot harder for us to get the right diagnosis and the right treatment for you.
Right. The more information we have and the more accurate that information is, the more we can use that information to inform what options you have. So that would be another thing we would want to talk about at your appointment. What are you currently doing to try to improve things for yourself? So maybe therapy, or if you have some other kinds of treatment like acupuncture, or you're seeing a nutritionist, or I don't know, whatever else.
Therapy.
Sure. So what are you trying right now to help things? You might even be on medicine right now and it may not be doing what you had hoped it was doing. So we want to talk about what you're experiencing and what you've tried to do to help those symptoms. And then we'll talk through your goals. What are you hoping to achieve here? Sometimes it's just I want to have the information so that I can think about it and use that information at another time. Sometimes it's I want to get better now, and those are two different conversations. So we want to ask about what's the goal here? What are we doing?
Yeah, a lot of people come to us for planning purposes. So, I know I have these medications that I'm taking, but I really want to get pregnant. What's safe, what's not. So really knowing what what your purpose of being there is really helpful for us to kind of tailor the conversation in terms of treatment. And so treatment is often what we go into at the end of the appointment, where we kind of give you the different options of things that might be helpful for someone in your situation.
If medications are part of the treatment options for you, then you and your psychiatrist should have a risk-benefit discussion, meaning you're going to talk about what are the potential side effects or the potential problems with this medication, and what are the potential problems with not treating what you're experiencing. And then talk about how medication could be helpful to help you reach your goals. So you want to know about how long it's going to take for your medication to potentially be helpful, what side effects you can expect, when to take it, how long you expect to continue this treatment if it is effective. Those would be important questions to ask, and things that I think the vast majority of psychiatrists talk about with their patients.
Yeah, and I think that this is a point in the appointment where your questions are equally as important. So getting all the information that you need to know is fine. That's perfectly okay. That's definitely within your right. It's also within your right to say that's not something I feel comfortable with, or that's something I want to think about. You never have to make a decision in the actual appointment. You can always bring that information to talk with someone else, or just to kind of think about. And oftentimes, if you ask for more resources, a psychiatrist or your physician is a great person to ask for those resources. That way you're not just going on the internet and finding YouTube videos on it.
To sum up, we're going to talk about so many things together. Hopefully you're in a comfortable environment, that you're comfortable with your physician, that it most likely, I think most people will tell me that it was way less scary than they anticipated that it was going to be. That we're just sitting and having a discussion about what's going on, and I happen to have information that could be helpful for you. So I hope that having this information is helpful and helps you feel a little bit more comfortable going into your first appointment.
Yeah, and hopefully it doesn't feel as scary as it might have otherwise.
Thank you for being here today. Please, if you like this video, like, comment, and subscribe to our channel. We'll see you soon.
Bye.